Measures in Epidemiology Part 1. The frequency of disease occurrence or measures in epidemiology can tell how much of the severity, how fast of the disease is occurring in a population, or what are the risk factors among population. The outline of this session are: measures in epidemiology, measure of disease frequency, mortality-related measures, measure of association, measure of impact. The objectives are to 1. Describe importance of measures in epidemiology. 2. Explain the differences between incidence and prevalence. 3. Describe 3 types of measures in epidemiology, which are measure of disease frequency, measure of association, and measure of impact. The basic element of measures in epidemiology is knowing the magnitude of diseases or public health problems. Be able to measure the magnitude of disease occurrence or compare disease occurrence among various population. In order to examine the importance of a disease or public health problems, we need to be able to measure the frequency of disease occurrence and deaths from the disease. Measures in epidemiology will aid field epidemiologists or public health sector to identify public health problems, allocate appropriate resource to solve public health problem, and monitor and evaluation of the disease prevention and control programs. World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease of infirmity. The definition of health or case definition is vital and meaningful for epidemiology in order to classify population into various groups. For example, individual with disease and individual without disease. The level of a disease in a population changes over time, so that case definition will be the tool to define each individual in the categories according to the level of the disease. The case definition needs to be valid, clear, and simple so that common understanding among team members will be agreed correctly and easily. The case definition should include clinical manifestations, person, time, and place clearly. Before we go into the details of measure in epidemiology, there are some definitions should be clarified. Proportion is defined as the comparison of a part to the whole, which the numerator is included in the denominator. Ratio is defined as the relative magnitude of two quantities or a comparison of any two values. Rate is defined as a measure of frequency with which an event occurs in a defined population over a specified period of time. Proportion is the comparison of a part to the whole. For example, if a farm has 100 sheep, in which 40 sheep are sick, so that the proportion of sick sheep in this farm is 40 divided by 100 equal to 40. Ratio is comparison of any two values. For example, if a farm has 100 sheep, in which 60 sheep are male and 40 sheep are female, so the ratio of male to female sheep of this farm is 60 to 40 equal to 1.5 to 1. Ratio is a measure of frequency with which an event occurs in a defined population over a specified period of time, which calculate from number of case divide by sum of person time. For example, of the rate of new HIV infection among men who have sex with men in Bangkok are 5 men per 100 MSM population per year. Measures of frequency reflect the relative occurrence of the disease in a population. Measures of association reflect the strength or magnitude of the statistical relationship between exposure status and disease occurrence. Measures of impact are used to predict the impact of an intervention on the disease occurrence in a population. The basic measures of disease frequency are incidence and prevalence. However, before we describe how to calculate the incidence and prevalence, the population at risk needs to be understood first. Population at risk is a group of people who would be counted as a case if they had the disease being studied. The importance of considering population at risk is illustrated by an example. In a study, the occurrence of cervix cancer, the population at risk would be female whose age can develop cervix cancer like female in 25 to 69 years. The data of the population at risk can come from demographic data, geographic data, or environment data. For example, in a study of brucellosis outbreak in a goat farm, population at risk should be all farmers in the goat farm and butchers who involved in goat slaughtered of the goat from that farm. Prevalence is defined as the number of affected persons present in the population at a specific time divided by the number of persons in the population at that time. Prevalence is often used in two ways. Point prevalence of the disease at a certain point in time. This is the use of the term prevalence that we just discussed. Point prevalence can determine the burden of disease in general. Period prevalence, how many people have had the disease at any point during a certain time period. Example of point prevalence of diabetes mellitus cases in District A at December 31, 2020 equal to number of DM cases at December 31, 2020 times 100 divided by size of population of District A at December 31, 2020. Period prevalence of diabetes mellitus cases in District A of year 2020 equal to number of old DM cases at January 1, 2020 plus number of new DM cases in 2020 times 100 divided by average population of District A of 2020. What is the difference between incidence and prevalence? Prevalence can be viewed as a snapshot at which we determine who has disease and who does not, but we are not determining when the disease developed. Incidence defined as the number of new cases of a disease that occurred during a specific period of time in a population at risk for developing the disease. The critical element in defining incidence rate is new case of disease or new event. Because the incidence rate is a measure of events that transition from a non-disease to a disease state, the incidence rate is a measure of risk. The denominator of an incidence rate represents the number of people who are at risk for developing the disease. The first type of denominator for incidence. All of individuals in this group represented by the denominator have been followed up for the entire period. We call it the incidence proportion or cumulative incidence. However, often individual in the denominator has not been followed for the full time specified or death. When different individuals are observed for different lengths of time, we calculate an incidence rate also called person time incidence or incidence density. The denominator consists of the sum of the units of time that each individual was at risk and was observed. Incidence measures can use two types of denominators: people at risk who are observed throughout a defined time period, or when all people are not observed for the full time period. Person time. Example of incidence proportion. A cattle farm. In 2019, there is no sick cow among 100 cows. Then, in 2020, among 100 cows, 31 cows develop foot and mouth disease. The incidence proportion of foot and mouth disease among cattle in this farm in 2020 is 31 divided by 100 multiplied by 100 equal to 31. Example of incidence rate. A study of incidence rate of ventilator-related pneumonia in a hospital. In total year of 2020, there are 100 patients who are assisted by ventilator, and the sum of ventilator-assisted days are 1,000 days. 20 patients develop ventilator-related pneumonia, so that the incidence rate of VAP in this hospital in 2020 is 20 multiplied by 100 and divided by 1,000 equal to 2 cases per ventilator-assisted days. For the outbreak investigation, we speak of an attack rate, which is defined as the number of people exposed to a hazard who became ill, divided by the number of people who were exposed to that hazard. Crude attack rate equals number of cases, divided by number of population at risk. Moreover, in an outbreak, disease can transmit from one to another, so we speak for secondary attack rate to measure disease's infectiousness. Secondary attack rate calculate from number of persons become ill after exposed to the primary case divided by number of persons exposed to the primary case. Mortality rate from all caused in a period of time called 1. Crude mortality rate calculate from number of deaths in a specific period divided by number of total population multiplied by 1,000 or any other figure. Note that because the population changes over time, the number of total population at mid-year is generally used as an approximation. We may not always be interested in a rate for the entire population. Perhaps we are interested only in some age group. We can calculate a mortality specifically for a group of population, for example mortality rate among children under 5 years or among male population, which is 2. Specific mortality rate. 3. Case fatality rate calculate by number of deaths from the disease in a specific period divided by number of total cases of the disease. In other words, what percentage of people who have a certain disease die within a certain time after their disease was diagnosed. This video produced by Department of Disease Control, Ministry of Public Health.